Hello, welcome to Coffee with Kelsey. I'm happy to invite you here today to learn more about Adoray Home Health and Hospice and introduce you to some of our team members. Today I'm joined by Tina McLeod, our Education Manager. Welcome, Tina.
Thank you, Kelsey.
And today we're going to be exploring the topic of when hospice becomes a reality. So the initial conversation we want to have is just to learn more about when a loved one has a need for hospice care, and we start that challenging conversation with them. It's oftentimes difficult for families to know when the time is right and how to bring up that topic. So this brings me to my first question. When is hospice appropriate?
Good question, Kelsey. And really the big thing is it can be very different with every patient. The big thing we want to be looking for is our loved one having changes. Are they starting to need more help with activities of daily living, things like bathing, they're having problems with incontinence, a bowel or bladder, things that have really changed for them. Are they having weight loss, decreased appetite? Are they needing to go to the doctor, the emergency room more often? What's going on in their health? Is their health starting to decline? What's their doctor telling them? You know, don't be afraid to ask the doctor, what are you thinking as far as mom or dad? Are they offering them options that they don't want to do? Maybe perhaps mom has a cardiac disease and they have some kind of procedure they'd like to do and she's electing not to do it. What are the ramifications of that and how can we support her for symptom control? Being okay with asking the doctor those types of questions. Do they have a treatment that they decided to stop? One we see a lot is dialysis patients often are going to into the clinic 3 times a week for hours to get their dialysis. Are they choosing that they don't want to do that anymore? Chemo patients who maybe are having a lot of side effects from the chemo and it's no longer doing what they need. Things like that. So if you start seeing those things with your loved ones, that's a good time to start asking those questions and start having those conversations with your loved one.
So if I have a loved one that I think is hospice appropriate, how do I know if they're eligible for hospice benefits?
Well, first thing, call us. We can either do an interview over the phone, ask some questions about their health and kind of get an idea ourselves. Medicare has very specific criteria for different diagnoses that can help us, so we can have pointed questions based on whatever diagnosis the patient has that we can ask. But if they don't fit into a criteria, we could even potentially go out and do a visit, talk to their physician and see if we can find some way to help them with that meeting eligibility. But that's up to us to figure out. So if you're having questions, that's just something that you should just give us a ring and we would be glad to help you with that.
Wonderful. So my loved one is hospice appropriate, hospice eligible. What comes with hospice care? What does that include?
Well, hospice is a very team holistic approach. So you get a team of individuals who are coming out to meet with your family or the patient to help with symptom control. So it's going to start with a nurse case manager. That is going to be the main face that you're going to see, and her main function is going to be symptom control for that patient. But then we also have social workers, spiritual counselors. They deal more on that emotional, spiritual level, helping with caretaker issues. The one thing, having been in hospice for most of my nursing career, if we don't have that family, those caregivers emotionally stable and understanding what's going on, it's really hard for those nurses to ever get that symptom control. So that team approach is extremely important. Then we also have home health aides that may help come in and help with bathing, might help with some other activities of daily living, whatever it is that is needed in your particular situation. Volunteers, massage therapy, who can come in for some symptom control. There's a lot of different team members that are involved. In addition to that, the hospice Medicare benefit pays for any DME that is needed in order to be able to provide the care. So if mom needs a hospital bed, if they need oxygen, if they need a nebulizer, a walker, a wheelchair, whatever it is that they need, the nice thing about hospice is we can get that stuff usually the same day. You're trying to get it through Medicare just without hospice involved. There's all kinds of red tape, and sometimes it can take months. So we can get that stuff right away for you if we feel that that's something that you need to provide the care. Also, we would another thing that we would provide would be medications that would help with symptom control for that patient. So all of those things are all wrapped up in that Medicare hospice benefit and are free of charge. So it's to you. So it's a pretty big benefit. Lots of things that you get.
And so you've touched on this slightly on the cost of some items might be covered, like DME or medications, but what does the overall hospice care, what does that cost look like for me as a caregiver or for one of my loved ones?
Well, if you are on Medicare, it is part of the is part of the Medicare benefits, so there's no cost to you. It is also covered by most insurances and medical assistance as well. There might be some copay or deductibles you have to meet with insurance, but we would figure that all out ahead of time and let you know that up front.
Wonderful. So going back to the hospice care and the services involved, is hospice care 24/7, round the clock?
No, it is not where somebody is going to be in your home 24/7 caring for the patient. The family is still that primary caregiver. However, if you're having issues, if you're having symptom control issues, emotional issues, family support, we are available 24/7. We're just a phone call away and we will do what we can to support you. The family would be taught and supported in providing that 24-hour care.
Wonderful. And if I have a loved one, I'm thinking of numerous ones of them right now that could benefit from hospice care, should I have them reach out right away? Should they wait? When's the best time to contact?
The one thing when I was out in the field and working with families that I heard the most is they all wished they had come on hospice sooner. The sooner that you come on hospice, the more that we can do for you. That relationship in hospice is so important. It's important that we get to know your loved one so we know what is truly of value to them, and that helps us to drive their care plan. If the patient's already actively dying, that's a lot tougher. And then we're tending to deal just with symptoms. So if you're having questions where you think that person may qualify, it's always better to reach out. You're going to get the most benefit from the program that way.
Wonderful. Thank you, Tina. Thanks so much for joining me today to learn more about hospice and what it entails. And tune in next time for Coffee with Kelsey.
Thanks for having me, Kelsey.